Susan, can you tell us about the 4 guiding principles of motivational interviewing?
Sure. Well, there's a neat little acronym that Miller and Rolnick uses called RULE. And this was actually developed just for healthcare providers in briefer encounters. And the first one is resist the writing reflex. And we talked about the worst case scenario where the provider wants to jump in and fix and prescribe and scold and tell. So the first rule is to say, just don't go there. Don't push. Resist that urge to go in and fix. The second one is understanding and exploring the patient's own motivations for change. And you can see how that would be really important. That's going to be much more effective than me telling someone why they should change. So if I can pull it out, understand it, and use that to help guide their plan, that's going to be very effective. The third one is listening with empathy. And when we say empathy, we're not talking about sympathy or talking about my own experiences. We really truly are trying to understand the unique challenges and situation that the patient faces. By validating that, by truly understanding, the patient feels accepted, understood, and they're much more receptive and much less defensive to talking to us about change, even if it's something that they're not quite ready to make. The last is empowering the patient. And to empower the patient, we need to really build their confidence. So much of the time that what we think is presented as not being willing to change, it's really a lack of confidence that they can. We're asking patients to make huge changes in their lifestyle. And it's difficult, it's challenging. So by empowering the patient, we can help give affirmations, look at the positive steps that they have made, affirm that, build their confidence, and leverage that activation to take the next step.
And we talk a lot about, in the CCP program, about the authoritarian or paternal model of care that has guided acute care for so long. And obviously with acute conditions, that kind of directive, extremely directive care is very important and effective. But if we're using that kind of authoritarian care, overly directive care with patients who are already feeling hopeless or a low sense of self-efficacy or effectiveness, that probably isn't going to be very effective.
No, it really shuts them down, absolutely. And so I think by using the principles that we just talked about with this motivational interviewing approach, we actually can have the opposite effect. We actually can take what we call the non-adherent patient or the resistant patient, and we can have a totally different experience with them, because when someone does feel accepted and we can help increase their confidence, we have someone that's willing to take risks, that's willing to be a little bit more receptive, and then we can share our clinical expertise with them.
So, according to motivational interviewing, there is no such thing as an unmotivated patient. Is that correct?
Well, I would say that to find a patient that has no ambivalence at all, that's just dead set against doing anything to improve their mental or physical health, is extremely rare. And even if someone is in a pre-contemplative phase, we still can find that ambivalence. We can plant that seed. At least we can build the rapport so that when they are ready to make the change, they're going to be much more receptive to talking with us again.
And that might be a conversation with a physician about smoking cessation at one visit. 3 months later, a nurse may reinforce that or ask a key question. Everybody on the team is playing a part in that process, and that might not be a quick fix.
Right.
It's not something that is going to be resolved in one session. It's going to be reinforced over time by members of the team.
Yes, and that is where we have to just surrender our own agenda. That change is a natural process, and it's everyone's right and choice to make those changes. They may not like the consequences, but it is their choice. And so by taking the onus off of ourselves to fix the problem, by simply being a change agent to accelerate the process, to facilitate the process, that I think we view our role differently. And again, it takes the frustrations out.